With coronavirus cases rising and the Omicron variant threat growing, testing for COVID-19 has become more commonplace. Many families who plan holiday events are using both home and outside tests to make sure it's safe to gather. There are hundreds of testing sites across Southern California, and rapid test kits can be bought at pharmacies or ordered online. If you're going to be indoors, you all should be testing before you show up at that gathering, Los Angeles County Public Health Director Barbara Ferrer has said. Testing at LA County-run sites are free, regardless of immigration status. Orange County residents can request free self-collection test kits that will be sent to them, and residents can submit specimens to the lab in an envelope with prepaid shipping. Even if you're fully vaccinated, getting tested before or after gatherings or parties can make a difference in whether why. Terashita, Associate Director of L County's Acute Communicable Disease Control Program. Here is information on getting tested. San Bernardino CountySanta Barbara County. If you have symptoms, health officials say you should get tested. A negative rapid test result may seem promising, but Terashita suggested that a symptomatic person follow the test with a PCR test, in which a sample must be sent to a lab for analysis, with results coming back in 1 to 2 days. Anyone who is symptomatic, even those who have a negative rapid test, should stay home and away from others, Terashita said. Rapid tests can result in a small number of people getting a negative test result when they are actually positive for the virus. If a rapid test is positive, you must consider yourself infected and isolate immediately, Terashita said. You can consider following up the rapid test with a PCR test to confirm the infection. It's irresponsible for people who test positive to continue going out and leaving home without adhering to isolation requirements, Ferrer said. Those who test positive must stay home for at least 10 days after their symptoms began, or, if there are no symptoms, then at least 10 days after the test was taken. Dr. Paul Sachs, an infectious diseases expert at Harvard Medical School, said during a UC San Francisco forum that when he visits his elderly parents, he takes a rapid test right before he sees them. He said it's important that people conduct the test as close as possible to the actual visit itself, not the day before. Sachs said he wouldn't visit family if he had any signs of a respiratory illness, such as a scratchy throat, even if the rapid test results showed a negative result. People should not use rapid tests when they have a respiratory tract infection as a way of reassuring themselves falsely that they may